3.
Good evening. Did you know that John Cougar Mellencamp and Hank Williams were born with a birth defect called spina bifida? Spina bifida occurs in about 8 babies born every day in the United States. On June 23rd of 2015, my son was one of those 8 babies. Spina bifida has no cure, and very little is known about how to prevent it and what causes it. My name is Susanne Taylor, and I'm here to inform and to raise awareness about spina bifida and the many obstacles that someone with spina bifida often faces, and to encourage you to donate so more research can be done. I will explain spina bifida, the symptoms and conditions that accompany spina bifida, and go over possible causes and possible prevention. So, what is spina bifida? Spina bifida is also known as neural tube defect. It is a birth defect that occurs within the first 28 days of pregnancy when the spine and the spinal cord do not form properly. The severity of the disability caused by spina bifida depends on the type of spina bifida and where the birth defect is on the spine. So let's look at the different types of spina bifida. We have spina bifida occulta. This is the least visible signs and usually does not cause harm. About 15% of healthy people are living with spina bifida occulta and do not know it. Then we have meningocele. This is where part of the spinal cord comes out through the spine like a sac. Individuals with these types have only minor disabilities and usually do not have any nerve damage. Then we have myelomeningocele. This is the most severe form of spina bifida. This is a type my son has. This is when parts of the spinal cord and nerves come through the opening in the spine. 70 to 90% of children born with this condition also have hydrocephalus, or too much fluid on the brain, which can cause brain damage. Treatments. How is spina bifida treated? There are a few methods of treating someone with spina bifida. You have surgery before birth. For babies with the most severe cases of spina bifida, doctors offer an option of having surgery on the baby while the baby is still inside the mother. This surgery is done as close to birth as possible to prevent the possibility of having an infection, and it also saves the spinal cord from more damage. I want to talk a little more about the fetal surgery. In the past 5 to 10 years, there have been doctors willing to operate on a fetus with myelomeningocele because they found out after an initial study that babies born after having the fetal surgery had a better prognosis than if they would have just left the baby alone. Then you have cesarean birth, also known as C-section. Most babies born with spina bifida, meningocele, or myelomeningocele are born by C-section to prevent more nerve damage and stress on the baby, which will undergo surgery within a few hours of birth. You have surgery after birth. And babies who have the surgery after birth are usually born via C-section. Within a few hours of birth, neurosurgeons will perform a surgery to try to repair the nerves and the spinal cord. My son was flown from UAB to Children's Hospital by helicopter, and the surgery was performed within 24 hours of his birth. We have conditions of spina bifida. The more severe the spina bifida, the more symptoms the patient experiences. Hydrocephalus. This is a condition in which excess cerebral spinal fluid builds in the ventricles of the brain and may increase pressure in the head. The normal flow of fluid is blocked, resulting in buildup. This will need a shunt to drain the fluid. You have the Arnold-Chiari malformation 2. This is a condition where part of the back of the brain shifts downward through the bottom of the skull area, causing issues such as trouble swallowing and breathing. Tethered cord. This is where the spinal cord movement is restricted at the base of the spine, causing tightness such as a pulling sensation, and it interferes with the movement. Lack of bladder and bowel control. Because of the nerve damage caused by spina bifida, the patient may not have the ability to control their bowels and bladder. This can result in the patient having to wear diapers throughout life, having a colostomy bag, or having to catheterize, or a combination of any or all of these above. Paralysis. Spina bifida patients can also suffer from paralysis depending on the location of the spina bifida on the spine, which can leave the child dependent on orthopedic braces or even bound to a wheelchair. And then you have scoliosis, and we all know that's the curvature of the spine. Ongoing patient care. Patients will have to be monitored for worsening problems throughout their lifetime, many times resulting in surgery or rehabilitation to alleviate the problem. We have neurology, urology, orthopedics, physical therapy, rehab, dietitians, and special needs teachers. Possible causes and prevention. What causes spina bifida? No one knows for sure. Doctors and scientists believe that a complex mix of both genetic and environmental factors act together to cause this condition. How do you prevent spina bifida? Since doctors are unsure of what causes spina bifida, there is little known prevention, but doctors suggest that women who are old enough to have a baby should take folic acid before and during the first 3 months of pregnancy. This brings me to my conclusion. I have explained what spina bifida is in depth, as well as symptoms and possible causes and prevention. This disability affects about 1,645 babies born each year. As you've heard, very little is known about the causes and prevention. More research needs to be done to help understand the causes and the way to prevent this birth defect. I can only ask that you to raise awareness to your friends and loved ones to help this cause. If we had more awareness, maybe we would have more funding. If we had more funding, maybe we could have more research and a better understanding of how to prevent this from happening to our loved ones. Every penny counts. Thank you.